Wake up in the morning and the first thing you feel is a stiff back. You get out of bed, the lower back aches. You sit down, the hip pulls. You lie down to sleep and you can't find a comfortable position. And you've already come to accept that it's just your norm. But here's what I'll tell you. In 90% of cases, this pain is tight muscles that no one has ever worked on. And they literally scream for help every day. I've got a regular massage roller in my hand. It costs next to nothing. It sits around in many homes, but most people use it wrong, and the pain doesn't go away. In this video, I've put together a complete set of 54 exercises for every area of the body, from heels to the back of the head. You don't need to do them all at once. There are timestamps in the description. Just pick the zone that's hurting right now and follow along with me. People who do this routine regularly end up forgetting where they used to hurt.
Shin. You can work on the inner surface just in a lighter mode, performing these kinds of rolls. You can increase the intensity by throwing the other leg over, adding more load. I'm increasing the intensity even more by carefully shifting my body weight onto my arms, and then I am fully loading the inner surface with my body weight. Depending on the specific mode you are working in, whether it's activation before a workout, a recovery procedure, or therapeutic work, the rolling time will naturally vary. That is to say, if you are activating before a workout, sometimes just a few gentle rolls are enough to get the job done. If you are doing therapeutic work, naturally, the time should be, well, at least a few minutes. Focusing on the back of the lower leg, this is a simple variation for this type of work. It is particularly effective when you are working on laminate flooring, as your glutes can slide easily, which really helps you minimize the load. A more difficult variation involves crossing the opposite lower leg over. Well, even harder is with support on your hands, lifting your pelvis off the floor. You can also continue to work on the outer surface of the lower leg in this same manner. The simplest variation. It gets a bit harder now. Make sure the leg goes forward. And then do it again, even harder this time, by simply crossing the other leg over. The front surface of the lower leg is worked on in the following way. You can work on both legs at once. If you have issues with your ankle or knee joints, I recommend working on your lower legs every day. I demonstrated this on one leg. Naturally, you need to work on the other one in exactly the same way. The thigh. The back surface, simple variation. The back surface, a slightly more difficult variation. The outer lateral surface, a simple variation, leg in front. A more difficult variation, just like with the lower leg. This is usually the moment where the groaning starts, and for good reason. You see, the vastus lateralis, a major part of your quadriceps, is frequently plagued by stubborn trigger points. I actually recorded a separate video about this specific muscle, which you can watch for more details. But for now, just know that this area is very often affected by these knots, and it can be quite a painful spot. After rolling on the lateral surface, you can immediately move on to the anterolateral one. Naturally, we also make sure to cover all of the intermediate zones as well, and the anterior surface. A much simpler option is just to do it like this, by resting your weight with support on your knee. Well, a more difficult one, naturally, is also with added weight, by throwing your leg over. After rolling along the anterior surface, we move on to the inner surface of the thigh. I recommend placing the roller perpendicular to the thigh. A simple option. This is a particularly effective exercise when your thigh adductor muscle group is currently in spasm and causing ongoing pain in the groin area. And here is a more difficult option to consider. It is not entirely comfortable, I admit, but this is precisely how I prefer to perform it. You can work on your thighs and your muscles in general in two distinct ways. The first method is when the roller slides along the length of the thigh, just as we demonstrated in the previous exercises. And the second way to perform this movement is when the foam roller remains completely stationary on the floor, while your leg is put into active motion. One of the most effective exercises for targeting the front of the thigh, specifically the quadriceps, is simply performing these kinds of controlled leg bends right at the knee joint, which helps to isolate the muscle group and improve your overall range of motion. You also have the option to perform quick rolls to the right and to the left. You have successfully found a trigger point area and are now working it out thoroughly in all directions. Once you feel that release, you can place both legs on the roller and perform slow, alternating leg bends to really target those muscle fibers. Start by simultaneously bending both of your legs, then transition into an exercise where you keep your legs bent while performing a controlled, circular rotation of the lower leg. The work is performed first in one direction and then in the opposite direction. A separate topic is working with the sacrum area. Carefully lie down on your back and make sure that there is absolutely no pressure on the spinous processes of your lumbar spine, ensuring that the roller is positioned comfortably under your sacrum. So, here is a simple, effective exercise for releasing tension in the muscles of the sacrum area. Slowly bring your legs towards you, straighten them upwards, bend them again, and then gently return your feet back to the floor. For the next exercise, you can begin by carefully bending your legs at the hip joints, and then proceed to perform these controlled rotational movements in a slow, steady, counterclockwise direction to help improve your overall range of motion. Feeling the surface of the sacrum and moving in a clockwise direction. Under no circumstances should you attempt to go onto the lumbar spine area. And one more exercise. Right here, directly in front of us, is the bicycle. Please do it slowly and please do not rush. At the same time, you will be actively strengthening your core muscles and working the sacral area quite thoroughly. How exactly can you effectively work on the gluteal area using a large massage roller? The first technique involves working specifically on the area of the middle and small gluteal muscles. The rolling motion is performed slowly and carefully in this segment right here. This is a simpler option. A more advanced option is by crossing both legs. Almost always, if you are experiencing significant problems with the hip joint, this specific region will become a very painful area. This happens because the abductor muscle group, which includes both the middle and small gluteal muscles, will most often be severely affected by the development of painful trigger points. You can also work with the gluteal area in the following way. Sitting comfortably on the foam roller, the simplest option is to slowly roll back and forth, making sure you are touching the surface with both of your buttocks at the same time to ensure even pressure. The variation involves crossing the leg over while simultaneously shifting your center of gravity towards the bent leg. For better balance, the gluteus maximus and piriformis muscles are worked very effectively. By the way, there was a video about them too, you can watch it. Naturally, you need to work on both legs. Start by moving back and forth in a controlled motion, then perform those same movements while turning the roller to the right and left. Practice this sequence in the simple version, and then try the more advanced variation, with one leg crossed over the other to deepen the stretch. If you have pain in the hip joint area, be sure to do these exercises. When you are working on your lower back with a large massage roller, again, just like in the previous version of working with the sacrum, please make sure that your back isn't lying completely flat, and that there is absolutely no direct pressure on the spinous processes of the vertebrae. You should shift your body at a slight angle to the side. Perform these kinds of slow, controlled rolls starting from the pelvis and moving all the way up to the rib cage. You can easily change the angle, moving almost all the way around to the side surface. Next, we move even higher to the thoracic region. Here, it no longer matters at what angle you are rolling. A simple way to work on your back is with your hands on the floor. There are various modifications you can try, such as placing your hands behind your head or simply keeping your hands back. You can perform this kind of work while in a static position. Then, proceed with rotations to the right and to the left. When I am rolling, I usually straighten one arm out like this, then I move even higher up to target the neck and shoulder area, and finally I turn my head to the same side to really help release that tension. Once to this side, once to that side. To work on the neck even more effectively, you can perform these kinds of exercises with your hands in front of you. You can even grab like this, bringing your elbows together and spreading your shoulder blades. It rolls out the side of the neck really well, targeting the exact area where the levator scapulae muscle, along with the splenius capitis and cervicis muscles, are located and often hold tension. Roll right up to the occipital ridge. Well, naturally you would look to one side and then, of course, to the other side. The side of the torso is often a source of significant pain. The large Latissimus dorsi muscle runs right through here, and it very frequently develops tender trigger points. A simple, effective option is to just lie down on your side like this, and by leaning on your pelvis and your arms, gently roll your body up toward the armpit, even moving slightly onto the shoulder area. And for those who are more experienced or well-trained, this version with the pelvis raised off the floor is significantly more difficult. But keep in mind it's painful at first. Also, using a large massage roller, men can work on the front surface of the chest. By rolling slowly, you can effectively target and massage both the pectoralis major and the pectoralis minor muscles for relief. The first option is when the roller is in this position. We perform rolling back and forth. It's especially beneficial if you enjoy strength training to work on it after you finish lifting weights, or before you start lifting to warm up the muscles. You move it back and forth, and then by carefully turning the roller, you can achieve a smooth, controlled movement from one side all the way to the other. Another exercise that allows you to work on the attachment points of the muscles to the occipital protuberances. You place the foam roller directly under the back of your head and simply turn your head slowly from side to side. Despite its surprising simplicity, doing this gentle exercise for just a few minutes really helps to relax the neck muscles, rest the head, and significantly improves cerebral blood flow. This exercise is especially effective if you have a vibrating cylinder that inserts right here. I have one sitting on the shelf over there. It provides a vibration that allows these muscles to relax even more. But when you work with a booster, you often get a feeling of itching in the nose area, and you might sneeze involuntarily. This is normal. On a large massage roller, you can also effectively work out your forearms by rolling them along various surfaces. You can work out your shoulders, especially the triceps area. It's inconvenient to do both at once, you'll slip off, but doing one at a time is wonderful. Place one arm out to the side and lean into it with your full body weight. Go ahead and try it. You might find that some people have very tight triceps, especially those who do strength training. First one arm, and then you extend the other arm. You can also work on the lateral surface of the shoulder. Press the corresponding arm firmly against your body and then continue to work on it right here. Change the angle. This effectively works out the entire deltoid muscle area. You can also work on the bicep area for relief. To do this, lie down and place your palm flat against the floor, facing down. Use your body weight to press down firmly into the ground, then slowly roll your arm back and forth to release tension. Another exercise that might not be immediately obvious at first glance involves working specifically on the temple area. Now, it might seem a little bit absurd to use such a massage roller on this delicate part of your face, but I really encourage you to try it out and see the effectiveness of this exercise for yourself. This is especially beneficial if you frequently suffer from tension headaches. In fact, if you are someone who gets migraines, you will often find that the temporal muscle is significantly affected and tight in these situations, so releasing it can provide real relief. And releasing it this way will help it relax. Friends, that's what I wanted to show you in this video. The link to this massage roller will be in the description. I hope this video was useful for you. See you in future posts. Support the video with a like. Good luck and stay healthy.